For millions of people, over-the-counter antihistamines are an essential daily shield. We swallow a tiny pill, and it actively calms our immune system down, preventing our bodies from overreacting to ordinary things like pollen or pet dander. One of the most popular shields on the market is Cetirizine hydrochloride. You probably know it better by its common brand name, Zyrtec. But over the weekend, the FDA announced a nationwide voluntary recall for specific lots of generic cetirizine tablets. The very medication millions of people trust to stop severe reactions has suddenly become a potential medical risk itself. Regulators discovered that batches of the allergy pill had been cross-contaminated with an entirely different drug, one designed to treat acid reflux. For consumers who are hypersensitive to that specific reflux ingredient, ingesting the compromised pill carries a reasonable probability of triggering anaphylaxis, a rapid and dangerous allergic reaction. So instead of suppressing an allergy, the contaminated pill actually smuggles the chemical trigger right past your body's defenses. The recalled tablets trace back to a massive manufacturing plant operated by Unique Pharmaceutical Laboratories in Panoli, Gujarat, India. Inside that facility, the allergy pills were accidentally mixed with ranitidine. Ranitidine is a stomach acid reducer, known widely as Zantac, that actually required a major regulatory reformulation back in 2025 due to previous contamination concerns. Massive pharmaceutical facilities handle dozens of volatile compounds under the exact same roof. A physical processing failure can cause two completely separate drug pathways to physically intersect. The compromised batches then bypass the factory's automated sensors and digital checkpoints without triggering a single alarm. The issue was only caught because a human pharmacy technician, manually counting out tablets on a tray, stopped when they noticed something unusual. The typically solid white pills were speckled with strange red dots and unexpected discoloration. A sharp eye at the absolute end of the supply chain was the only thing preventing a factory error from becoming a widespread medical crisis. The danger here comes down to a biological concept called hypersensitivity. When certain people ingest ranitidine, their immune systems misidentify the chemical as a severe threat and immediately launch a violent defensive strike. On the left, cetirizine actively blocks the body's allergy receptors. On the right, the ranitidine contaminant bypasses that block entirely, agitating the surrounding immune cells. This agitated immune system triggers anaphylaxis, causing the throat to swell shut and blood pressure to crash. In a matter of minutes, swallowing a routine morning allergy pill becomes a life-threatening medical emergency. Fortunately, the manufacturer has halted all distribution, and as of now, they have not received any reports of adverse medical events from the public. If you take generic Zyrtec, check your medicine cabinet. The recalled antihistamine comes in a high-density polyethylene bottle containing 100 5-milligram tablets. Here are the exact identifiers to look for on the label. Check for the National Drug Code 16571-401-10, alongside an expiration date of October 2028. If those match, verify the lot number. The FDA explicitly flagged 4 manufacturing lots: GY825029, GY825030, GY825031, and GY825032. Cross-referencing those exact numbers against your bottle is the only definitive way to confirm your daily medication is safe to take. This incident highlights the immense, invisible global supply chain required to put a simple pill into your local pharmacy. Millions of times a day, we place complete, blind trust in the chemical purity of identical white tablets, assuming the automated systems are flawless. Yet despite that massive global infrastructure, public health was protected here simply because one attentive local technician noticed a strange red spot on a pill.